Good afternoon and happy Memorial Day. Memorial Day is a special holiday to celebrate all of the folks that have done service for the country, who have passed in that service, and for all the heroes in our lives. Happy Memorial Day. This week, what I wanted to do is talk to you about what are the college's plans that we now have in place. Last Friday, I actually submitted a comprehensive plan along with a census of the people who will be in the college in June through August. As a part of that plan, there were 4 teams that were created in March. The first team was for didactics, led by Dr. Paxton. The second team was led by Dr. Chang for pre-patient care simulation clinic. And team 3 was led by Drs. Rowan and the managing partners for the clinical reintegration. And team 4 was led by Dr. Cooper for the research and for the advanced residency education programs. So for team 1, Dr. Paxton's been working through the summer in terms of bringing up to speed all of the online education for the SGL through the summer, planning into the fall, and also getting ready for our new D1 class that will be starting in August. Dr. Chang has been leading the pre-patient care simulation group, which has done a wonderful job actually being able to create a plan to bring all 3 of our classes that still need simulation or pre-patient care activities to get them up to speed in their respective educational programs. This is especially important for the D3 students so that they can enter into the clinic in August to September. Now, Team 4, which is Dr. Rowan and the managing partners, have done a wonderful job to also be able to create a comprehensive clinical plan that's phased. Phase 1 of this plan, which is the objective is that student-patient care would start around June 8th, would be phase 1. Now, phase 1 is going to be for those types of clinical activities that are at the lowest risk. In other words, not generating much aerosol. These would be, for instance, to have our patients of record back, check in on them, see how they're doing now, confirm the treatment plan, and confirm if there's been any changes in their clinical status or their health status. This would also include things like urgent care for our patients of record, things like imaging, preliminary impressions, some removable prosthodontics or fixed prosthodontic procedures where an aerosol is not needed for the provision of care. Now, we would also then be moving then to what we call a phase 2. Now, phase 2 would occur later in the summer. This would then involve more of a potential moderate risk where, in other words, some aerosols are needed to be generated. This would include examples such as more comprehensive recall examinations, things like teeth cleaning without the ultrasonic, scaling and root planing, direct restorations using a rubber dam, isolite, and the four-handed dentistry, as we talked about last time, as the co-providers. Removable prosthodontics, again, where there can be control very carefully of any aerosols, orthodontic procedures, or potentially mouth guards. Phase 3, we're anticipating now as a staged care, would then be looking more potentially into July into August. This would be procedures that would tend to potentially routinely generate an aerosol. We're looking, as we talked about before, a number of aerosol mitigation steps, but this would be now where we are looking at more, for instance, crown preparations, using a variety of different isolation techniques, for instance, isodry or what we call a split rubber dam technique, to be able to do the crown preparations in a safe environment. Again, this is the whole idea behind the four-handed dentistry approach that we've been talking about. This would also allow us to do also potentially some extractions and some other clinical procedures in the dental student clinics that would generate aerosols. Now, Team 4 is for the residency programs and the research, and Dr. Cooper has been working very hard, and each of the program directors have generated also a comprehensive set of stage plans to bring the residents back into care across the college. This is the phase 1, which has actually already started, primarily emergency care, into the stage 2, which is to start on June 1. Again, this all depends on the virus. We've been trying to also help a lot with the research and the research communities. Dr. Cooper has been working very hard with Dr. Groden, the Vice Chancellor for Research for the USC campus, looking at how we bring our research folks safely back into the laboratories, reactivating a lot of the important research activities that we now need to do that need to be taking place in the lab. and then making sure it fulfills all of the standard protocols and procedures throughout the entire building. We're also doing a number of other activities to provide safe areas, for instance, to have lunch throughout the building, all again around this concept of physical distancing and making sure all of our people in the college, the faculty, the staff, and the students and patients are as safe as possible. We are providing ongoing communication, and I want you to please follow the emails that come out. The emails may come out from academic affairs, clinical affairs, faculty affairs, or potentially even from supervisors in your respective units. So be on the lookout for those, because they all convey very important information. Along with Dr. Rowan's Monday Minute, My Smile of the Week, that comes out on Fridays, and this little video chat that we've been trying to do each weekend through this little episode. We are planning some additional town halls for each of the constituents, the faculty, staff, and students, and again, to help to provide communication that sometimes is targeted to specific groups, but wanting to make sure we are providing as much communication as people need. Again, I want to wish everyone a happy Memorial Day, and also please be safe. We will get through this. Thank you very much. More to come.